We knew there was a protective effect of the rapid response team or the SPOT team following patients that left the intensive care unit, but we didn't know why. One of the great things that we did when we first started the rapid response team program in Ontario was we developed a provincial database. And we also had a local database that we could access as well. So luckily, one of my colleagues, Dr. McNally, and I sort of thought of a big idea that we could use our database to see if we could uncover the reasons why the SPOT team or MET team were helping children after they left the intensive care unit. So we delved into this database and actually found that there was kids that we were helping. Actually, most kids we were helping. All kids that left the intensive care unit needed to see the SPOT team at least one time after they left the intensive care unit. But Dr. McNally's bigger question as a SPOT team physician was, are there kids that don't need to see the SPOT team on the second day? And could we be using those resources differently? And definitely through our research and through a lot of case reports and going through all the charts and also the database, we found that there were kids that we don't need to see, that they do perfectly fine after the first visit and we don't need to see them again, therefore freeing up the SPOT team nurse's time and the physician's time and the respiratory therapist's time to do something else more efficient. What we did find was there are kids that we do need to follow, and those kids were kids that had recent surgery or had multiple organ systems, so their heart had some difficulty or their lungs weren't working as well or they're known to have something they were born with. They needed to be followed again. One of the things that we're really excited about now is using our database to figure out what happens to these kids that are seen by the SPOT team or the rapid response team. Do they stay in the hospital longer? Are they sicker? Do they need more support? So we're really excited to look at this data because maybe it can change the way SPOT works on those patients up on the ward instead of the patients that just leave the intensive care unit. Certainly I didn't come into being a pediatric intensive care physician or a pediatrician or a doctor wanting to do research, and I'll say that. But what's so exciting is that I took my love of my clinical job, meaning being the SPOT team medical director, and actually saw that I can turn it into research and that I can use research to help my clinical job. And I think that's what makes research so exciting, is that instead of thinking I'm going to be a researcher, it's being a clinician, but using the data that we're getting to actually change practice. And so to me, that's what research is can I do something in research that will actually change my day-to-day and change the day-to-day of my colleagues, and that's what we've done here with our SPOT team research.